What is oral thrush? Oral thrush is a condition that is caused by development of yeast infection on the tongue or within the walls of the mouth of an individual. Oral thrush is also referred to as oropharyngeal candidiasis, thrush or candidiasis of the mouth. A type of fungus known as C. albicans, Candida albicans, is responsible for causing oral thrush in both young children and adults but mostly affects toddlers and infants. A minimum quantity of Candida albicans is harmless as everyone has it in their mouths. It is only problematic when it outgrows the right quantity. And beings to destabilize the state of the mouth leading to oral thrush infection. Toddlers and infants are the most affected by oral thrush as it results in formation of white bumps on the tongue and inside of the cheeks and disappears soon after the patient receives treatment. Oral thrush is uncomplicated ailment as it is usually mild. Sometimes the state can be worse for the toddlers and infants due to weak immunity system. How is oral thrush in appearance? What symptoms show oral thrush? At the early stages, oral thrush shows no visible symptoms, but as the fungus gain ground and expands to the tongue and inside cheeks, these symptoms may begin to show. White creamy bumps begin to show inside cheeks, on the gums, tongue, as well as the appearance of tonsils. Moderate blood coming from the bumps on scraping. Irritating pain in places where white creamy bumps are seen. Cracked dry skin seen at the curves of the mouth or angular chylitis, trouble swallowing food, saliva or anything else. Mouth tastes sore most of the time if not always. Facing hard time while eating. Pedantry. Feelings of irritation. It is worth noting the oral thrush can be transferred through breastfeeding from babies to mothers, which can result in endless infection between the infant and their mothers. Some of the signs that will be seen when the breast is infected by Candida albicans fungus are nipples feeling painful, sensitivity and too much itching, shining skin or flaking around the nipples surrounding, excessive pain while breastfeeding, sharp, pinching pain felt in the bras. The cause of oral thrush. The causative agent for oral thrush is the Candida albicans, also referred to as C. albicans fungus. Oral thrush therefore begins appearing in the mouth or inside of cheeks of the patient when the growing Candida albicans fungus becomes uncontrollable. In normal conditions, the body keeps the other bad bacteria, fungus and Candida albicans in check through good bacteria, fungus. When the equilibrium is disrupted, dangerous fungi and bacteria start to reproduce, leading to the growth of oral thrush infection. In some cases, the immunity of a person is reduced as a result of using given medication, thereby the quantity of the good bacteria responsible for guarding the body is reduced, and then oral thrush occurs. Treatments methods used to manage cancer such as radiation or chemotherapy destroy the good cells and make the body vulnerable to other diseases as well as oral thrush. HIV and leukemia are also known to make the body vulnerable to oral thrush because they severely weaken the body immunity. For diabetic patients who haven't managed to control their blood sugar levels are likely to suffer bouts of oral thrush because the fungus responsible for causing oral thrush thrive very well in high sugar content in the saliva. Research has found out that Candida albicans fungus takes advantage of the excess sugar in the patient's mouth to speed up its growth. It is not very likely that the newborn infants can contract oral thrush during birth, but it is possible. The characteristics of the fungus responsible for causing candidiasis infection in women is similar to that which causes oral thrush. Therefore, women who are pregnant and are infected with candidiasis are more likely to infect their newborns at birth time. You can find out additional information about candidiasis in pregnant women. Who is likely to suffer from oral thrush? Toddlers and infants are the most susceptible in contracting oral thrush, but it does also infect persons with low immunity. Those with low immunity are more likely to contract oral thrush if you have HIV, anemia or diabetes. You are suffering from a disease that makes your mouth run dry. Using corticosteroids or antibiotics. You are under cancer treatment through radiation and chemotherapy. You are wearing dentures. You take cigarettes. You underwent transplant of an organ that can enhance fungus infection. Diagnosis of oral thrush. Your physician will observe your tongue and inside of cheeks for visible symptoms such as white creamy bumps in order to diagnose oral thrush. Additionally, the physician may request diagnosis confirmation through biopsy in the medical laboratory. For biopsy to be carried out, the lab technician will get sample from the patient's mouth by scraping portions of the affected parts of the mouth. The specimen is taken to the lab for examination of the presences of Candida albicans fungus. For acute infection of oral thrush, your physician can carry out additional examination through endoscopy or swab culture for the throat to determine if your esophagus is infected by oral thrush as well. When performing swab culture for the throat, your physician will collect a specimen at the back end of your esophagus using cotton swab. The specimen is then forwarded for analysis in the lab. Endoscopy, on the other hand, is achieved by applying camera and light attached to a narrow tube, always known as endoscope. The endoscope is inserted through your mouth into esophagus and an examination is done for the area affected, and tissue specimen can also be retrieved for further examination. Treatment for oral thrush. Oral thrush is treated depending on overall health of the patient and age, and it is done so as to curb the continuous spreading and growth of oral thrush fungus. Upon starting oral thrush treatment, the symptoms are usually gone in a number of days. There's a chance of a recurrence of oral thrush, especially if you have low immunity. To achieve comprehensive treatment for oral thrush, the patient need to be in good health and is not suffering from other ailments. In cases of oral thrush recurrence and the patient is generally healthy, the physician involved will carry out more examinations to determine the reasons behind the oral thrush recurrence. Medicines for oral thrush treatment. Oral thrush can be treated by applying these medical cures: diflucan, fluconazole, antifungals. Medicine for oral thrush: Miselex troche, clotrimazole. Your physician could recommend you antifungal known as lozenge, which is retained in the mouth as it dissolves slowly. Nistop, Nyata, Nistadin, is mouthwash swished and swallowed for infants. You swab it in the infant's mouth. Nistadin is antifungal. Sporanox, itraconazole, recommended for persons who have developed resistance for early cures and those with HIV. Ambisome, fungazone, amphotericin B, recommended for curing severe cases of oral thrush. Home remedies for oral thrush. To cure oral thrush in the comfort of your home, do the following: use a soft toothbrush while cleaning your teeth and do not scrap lesions. Consider getting a new toothbrush when you are done with treatment. Maintain your dentures thoroughly clean. Stick to recommended mouth sprays and mouthwashes alone. In case you are diabetic, ensure that keep your sugar level in check. Additional home remedy option for oral thrush: take a mixture of saltwater while rinsing your mouth. Take between 1/4 to 1/2 teaspoonful of salt and add to 8 ounce of water, preferably warm, in order to make a mixture of saltwater. Consume raw yogurt for restoring and keeping equilibrium conditions of normal bacteria. Oral thrush cures for breastfeeding infants and mothers. Suckling mothers and their infants both require oral thrush cures if either of them is infected in order to break the endless reinfection. Oral thrush cures for such situations could include, but not limited to, applying breasts with cream for oral thrush fungus for the mother and give oral thrush medicine to the infant, for example Lotrimin, clotrimazole, or Limasul, terbinafine. Clean the cream from the breast every time before breastfeeding the infant. Using a mixture of half vinegar and half water, rinse breast pump components, nipple bottles and pacifiers and let them dry. Hot water washing and drying in the sun can also be useful. To deter oral thrush fungus from the clothes, use nursing pads. Get nursing pads. Terbinafine and clotrimazole. Preventing oral thrush can limit the risk of contracting oral thrush by brushing of teeth and best oral hygiene practice, as well as daily floss for people who wear denture or are diabetic. Persons using inhalers such as corticosteroid should rinse their mouths. If you are under antibiotics, ensure you include yogurt in your diet. Ensure that you get the right cure for candidiasis during pregnancy.